Do you take safe meds for pain, heartburn, or a cold? What if I told you that, especially after 60, they may be secretly destroying your heart? Get ready for the truth the pharmaceutical industry doesn't want you to know. Look, I need to tell you a story that will completely change the way you see the medicine sitting in your cabinet right now. The same ones you take without a second thought because, after all, they're sold over the counter, everyone uses them, so they must be safe. Right? Wrong. Completely wrong. And the worst part? This information is hidden between the lines of package inserts, buried in studies nobody reads, and tucked away in statistics that never reach you. Let's start with the most common villain of all, the one found in just about every household: non-steroidal anti-inflammatory drugs, the NSAIDs. You know them by their brand names: ibuprofen, the one you take for any little ache; naproxen; diclofenac, your neighbor recommended for that back pain. They seem harmless, don't they? You get a headache, you swallow a pill, the pain goes away, and life goes on. But let me tell you what's happening inside your body at that exact moment. These drugs work by blocking substances called prostaglandins, which are responsible for inflammation and pain. So far, so good. The problem is that those same prostaglandins also have other vital roles in your body. They protect the lining of your stomach, regulate blood flow in your kidneys, and, believe it or not, help maintain the delicate balance of your cardiovascular system. When you block those substances, you're not just relieving pain. You're triggering a cascade of events that go straight for your heart. First effect, fluid retention. Your body starts holding on to sodium and water. You look in the mirror and notice you're more swollen. Your legs feel heavy. Your rings don't fit like they used to. But the problem isn't cosmetic. That fluid buildup increases the volume of blood circulating through your arteries. And what happens when you force more liquid into a closed system? Pressure rises. Your blood pressure shoots up, often without you even noticing, because you're not checking it every day. And here's the second hit. These drugs can directly interfere with blood pressure medications you may already be taking. Yes, you heard that right. That innocent anti-inflammatory may be sabotaging the effect of your hypertension medicine. It's like trying to put out a fire while someone is pouring gasoline on the flames. Your doctor adjusts the dose of the antihypertensive, but you keep taking ibuprofen on the side because it's just for the pain, and the vicious cycle continues. But wait, because it gets worse, much worse. These anti-inflammatories can significantly increase the risk of serious cardiovascular events. We're talking heart attacks, strokes, and heart failure. And it's not a small increase. Studies show the risk can double or even triple, especially if you use these medications for long periods or at high doses. And the scariest part? That risk exists even if you've never had heart problems before. You can have a perfectly healthy heart, start taking one of these drugs regularly for arthritis or chronic pain, and suddenly you're on the fast track toward a heart attack. For anyone over 60, the situation is even more critical. Your heart isn't the same young, resilient organ it was decades ago. Your arteries already have some degree of stiffness, maybe some plaque buildup, and your heart muscle may not pump as efficiently. Now add the extra stress these drugs create. Higher pressure, more overload, more inflammation in the vessel walls. It's the perfect recipe for disaster. And there's another detail nobody tells you. These drugs can cause or worsen heart failure. You know that shortness of breath when you climb stairs? The fatigue that never goes away? The swelling in your legs that you blame on age? It could be your heart losing the ability to pump properly, and the culprit may be sitting right there in your kitchen drawer, in that bottle of anti-inflammatories you buy every month. But hold on, because I'm not done exposing the dangers hiding in your medicine cabinet. Let's talk about another extremely popular villain: omeprazole and its cousins, the proton pump inhibitors, the famous PPIs. You know these meds well. Heartburn? Omeprazole. Reflux? Omeprazole. Gastritis? Omeprazole. Taking an anti-inflammatory? Better take omeprazole too, to protect your stomach. It's become a sacred ritual of modern medicine. Any stomach issue, the solution is to block acid production. And listen, these drugs are true miracles when used correctly, for short periods, for specific problems. The trouble begins when people, and many doctors too, treat them like candy. One every day, for months, for years, for decades, without questioning it. After all, if it protects your stomach, it can't be harmful. Right? Dangerously wrong. Let me explain the silent destruction mechanism. These drugs block stomach acid extremely efficiently, but that acid doesn't exist just to give you heartburn. It plays essential roles in digestion and, most importantly, in nutrient absorption. And this is where magnesium comes in. A mineral most people barely think about, but one that is absolutely vital for your heart. Magnesium is required for more than 300 biochemical reactions in your body. It helps regulate heart rhythm, keeps blood pressure stable, and allows muscles to contract and relax properly, including the most important muscle of all, your heart. When you suppress stomach acid for a long time, you can seriously disrupt magnesium absorption from food. It doesn't matter if you're eating nuts, leafy greens, seeds, all those magnesium-rich foods you read about. If your stomach can't process things properly, the mineral doesn't get where it needs to go. And what happens when magnesium levels begin to drop? At first, nothing. It's silent. You don't feel it. No alarm bells. But inside your heart, things start to unravel. Heart muscle cells need magnesium to maintain the correct electrical balance. When magnesium is low, that balance breaks down. The result? Arrhythmias. Your heart starts beating irregularly, out of sync, dangerously. And I'm not talking about the occasional mild flutter everyone feels once in a while. I'm talking about arrhythmias that can lead to sudden death, atrial fibrillation, ventricular tachycardia, those terrifying conditions you hear about in medical dramas and pray you'll never face. Chronic magnesium deficiency linked to long-term acid blockers may be putting thousands of people at risk for exactly these outcomes. And there's more. Low magnesium doesn't just affect rhythm. It can contribute to arterial calcification, raise blood pressure, worsen insulin resistance, and increase the risk of diabetes, which in turn is a major risk factor for heart disease. It's a devastating domino effect, all starting with that harmless little pill you take every morning before breakfast. And the most frustrating part, most doctors don't properly monitor magnesium levels. You go in for your annual checkup, get blood work, and they look at cholesterol, glucose, maybe triglycerides. But magnesium? Almost never. And even when they do test it, the standard blood magnesium test may not reveal cellular deficiency. Your body prioritizes keeping blood levels normal, pulling magnesium from cells and bones if needed. By the time the blood test finally shows it's low, you may already be severely depleted. Now let's move to the third silent killer that could be in your cabinet right now: oral decongestants. Your nose is stuffed up. Cold, flu, allergies, sinus issues. You go to the pharmacy and buy something with pseudoephedrine or phenylephrine. In a few hours, your nose clears like magic. You breathe better, sleep better, feel fixed. But let me tell you what's happening to your cardiovascular system while you're celebrating being able to breathe again. These drugs work as vasoconstrictors. They tighten blood vessels in the nasal lining, reduce swelling, and open the airways. Sounds perfect until you realize the problem. They don't tighten only the blood vessels in your nose. They tighten blood vessels throughout your entire body. Imagine all your arteries and veins suddenly getting narrower. What happens to the pressure inside them? It spikes. That's basic physics. For a young person with a strong heart and elastic arteries, the body can compensate somewhat, though it's still not ideal. But for someone over 60, for someone with high blood pressure, even if controlled, for someone with coronary artery disease, even if undiagnosed, it's like forcing an already worn-out hose to handle pressure far beyond what it was designed to withstand. Something will give. And it's not just blood pressure. These decongestants raise heart rate. Your heart starts beating faster, working harder, consuming more oxygen. If your coronary arteries, the ones that feed the heart muscle itself, are partially blocked, that increased demand can be the final straw. The heart asks for more oxygen, but clogged arteries can't deliver. Result? Angina, chest pain, or worse, a massive heart attack. And there's another danger, even more insidious: arrhythmias. These drugs can trigger irregular heartbeats, especially in people with a predisposition. You might be lying in bed, finally breathing through your nose, when suddenly your heart starts racing, pounding, skipping beats. It's scary, and it can be dangerous. Some arrhythmias can escalate into medical emergencies. The irony? Many people take oral decongestants because they don't want to use nasal sprays, which have a reputation for causing dependency. But the truth is, nasal decongestant sprays, when used correctly and for short periods, act locally in the nose with minimal systemic impact. Oral versions, they circulate through your entire body, hitting every organ, every vessel, every cell. You're sacrificing your whole heart just to unclog your nose. And here's a fact that should be printed in giant letters on the box, but often isn't. People with heart disease, uncontrolled high blood pressure, or a history of stroke should not take these drugs at all. Yet how often do you see it? How many people do you know with hypertension who still take those commercial cold and flu combos without a second thought because it's just a cold? Now let's go to the fourth villain in this dark story: tricyclic antidepressants. I know what you're thinking. I don't take antidepressants, so I don't need to worry. Not so fast. These medications aren't used only for depression. They're often prescribed for chronic pain, migraines, insomnia, diabetic neuropathy, fibromyalgia, amitriptyline, nortriptyline, imipramine. These names may be more present in your life than you realize. These are older generation antidepressants. Newer options are generally safer, but tricyclics are still widely used because they're cheap, widely available, and for certain conditions, they work. The problem is they come with a high cardiovascular price, especially after 60. One of the most dangerous effects is orthostatic hypotension. In plain terms, when you stand up quickly, your blood pressure drops sharply. You know that dizziness when you rise from bed or a chair? That moment where your vision darkens and you feel like you might faint? That's orthostatic hypotension, and tricyclics can make it much worse. Why is that so dangerous? Because orthostatic hypotension in older adults is a major cause of falls, and falls in older adults are no joke. Hip fractures, head trauma, wrist fractures from trying to catch yourself. A fall can be the beginning of a downward spiral. Hospitalization, immobility, complications, loss of independence. And many of these falls could be prevented if the cardiovascular side effects of the medication were taken seriously. But it doesn't stop there. These drugs can also cause cardiac arrhythmias. They interfere with the heart's electrical system, prolonging what's called the QT interval, a measurement of how long the heart takes to reset electrically between beats. When that interval becomes too long, you're at risk of a deadly arrhythmia called torsades de pointes, which can lead to sudden death. And there's more: dry mouth, blurred vision, constipation, urinary retention, common side effects of tricyclics that, while not directly cardiovascular, can harm quality of life and lead to other complications. Chronic constipation, for example, can cause straining, increasing intrathoracic pressure, which may trigger heart problems in predisposed individuals. Now picture the full scenario: a 65-year-old taking an anti-inflammatory for arthritis, omeprazole to protect the stomach, a decongestant for a cold, and amitriptyline for neuropathic pain. Each of these drugs on its own already carries meaningful cardiovascular risks, but together, the interactions and cumulative effects can be catastrophic. It's like stacking Jenga blocks. Each new medication makes the tower more unstable until a small disturbance brings the whole thing down. And here's the most frustrating part of all: most people have no idea these risks exist. Package inserts do mention things, yes, but in technical language, tiny print buried among dozens of possible side effects. Nobody reads them, and even if they do, they don't grasp the real seriousness. Doctors, often overwhelmed with 15-minute appointments, don't have time to explain every risk in detail. And pharmacies, you buy the medication, the pharmacist barely looks at you, let alone explains the real dangers you're taking home. Experienced doctors, those who've spent decades on the front lines, see this over and over. Patients who develop heart problems not because of genetics, not because of terrible habits, but simply because they've been taking safe medications too often for too long. Patients who show up complaining of fatigue, shortness of breath, palpitations, swelling, and when you review their medication list, there they are. The perfect cocktail for silently damaging the heart. And the most tragic part? Many of these drugs are taken without any real need. That anti-inflammatory you take just in case because you plan to exercise and don't want soreness later. That omeprazole you've taken for 5 years because you started it for gastritis that healed long ago, but nobody ever told you to stop. That decongestant you take at the first sign of a runny nose, even when you're not truly congested. That tricyclic you were prescribed years ago for a problem that's resolved. but you keep taking out of inertia because you've always taken it. The culture of a pill for everything is literally killing people, not always dramatically with sudden collapse in the street, though that happens too, but mostly slowly, progressively, silently. A little overload here, a little nutrient deficiency there, an occasional arrhythmia, until the heart simply can't take it anymore. And the pharmaceutical industry, it has zero incentive to shout these risks from the rooftops. These are billion-dollar medications worldwide, chronic treatments, people taking them for years, decades. It's a perfect business model, medications that create the need for more medications. You take the anti-inflammatory, develop high blood pressure, now you need an antihypertensive. You take omeprazole, develop magnesium deficiency, get arrhythmias, now you need heart medication. It's a machine that generates profit at every stage while you, the patient, become sicker, more dependent, more afraid. But it doesn't have to be this way. There are alternatives. For chronic pain, physical therapy, acupuncture, pain management techniques, and targeted exercise often work as well as, or better than, anti-inflammatories, without the cardiovascular risks. For reflux and heartburn, dietary changes, weight loss, elevating the head of the bed, avoiding heavy meals before sleep, simple measures that often solve the problem without needing long-term acid blockers. For nasal congestion, saline rinses, steam inhalation, identifying and avoiding allergy triggers, using humidifiers. These can help without overloading your heart. And for mental health conditions and chronic pain, there are newer medication classes, non-drug therapies, and integrative approaches that don't carry the same burden of cardiovascular side effects. The problem is that alternatives require time, effort, and lifestyle change. It's much easier to take a pill, but that convenience comes with a price. One many people only discover when it's too late, when they're diagnosed with heart failure, when a heart attack hits, when a stroke leaves permanent damage. That's when they finally stop and ask, how did this happen? I took my meds correctly, I was taking care of my health, not realizing those very care habits were part of the problem. Here's the uncomfortable truth. There is no medication without side effects. There is no pharmacological intervention without a cost to the body. Medications are powerful tools that save lives when used appropriately, for the right indications, for the necessary time. But when used indiscriminately, chronically, without proper supervision, without periodic reassessment of whether they're still needed, they become slow poisons. And your heart, this tireless organ that beats about 100,000 times a day, pumps more than 7,000 liters of blood daily, works nonstop from before you're born until the moment you die, does not deserve to be treated as an acceptable side effect. It deserves to be protected, cared for, respected. So what can you do? First, knowledge. Now you know. You can't claim ignorance anymore. You know those medications in your cabinet may be silently harming your heart. Second, communication. Talk to your doctor. Bring a list of everything you take, including over-the-counter drugs, supplements, and herbal teas. Ask whether each one is still necessary. Ask about cardiovascular risks. Ask about alternatives. Third, reassessment. How often do you take something out of habit instead of real need? Do you still need that omeprazole? Does your pain truly require an anti-inflammatory? Or could you try other approaches first? Do you really need that decongestant? Or could you manage the cold with simpler, safer measures? Fourth, monitoring. If you genuinely need these medications, make sure you're being monitored properly. Regular blood pressure checks, blood tests including electrolytes like magnesium and potassium, and attention to warning symptoms: shortness of breath, palpitations, swelling, dizziness, excessive fatigue. Don't ignore the signals your body is sending. Fifth, prevention. The best medicine for the heart is not needing medicine at all. Healthy eating, regular exercise, stress management, adequate sleep, maintaining a healthy weight, not smoking, these are the true cardiovascular protectors. They don't come in capsules, they don't have TV commercials, they don't make anyone money, but they work. Your heart is the engine of your life. When it stops, everything stops. It's not worth sacrificing it for the convenience of a pill. It's not worth quietly destroying it while you believe you're taking care of your health. Real health doesn't come from a bottle. It comes from informed, conscious choices that respect your body as a whole, not just treating isolated symptoms. And remember, the pharmaceutical industry, advertising, and even some misinformed or rushed health professionals will keep saying these medications are safe and you should take them without worry. But now you know the other side of the story. You know the real risks, the hidden dangers, the consequences nobody wants you to see. And with that knowledge comes the responsibility to protect your own heart, because no one else will do it for you. Your life literally depends on the choices you make every day. Seemingly small decisions, like which pill you take for a headache, can have enormous long-term consequences. Don't let today's convenience become tomorrow's regret. Don't let temporary symptom relief cost the long-term health of your heart. You deserve not only to live longer, but to live with quality, with vitality, with a strong heart that supports you through every season of your life.